instructor for Exploring Population Health. Exploring Population Health is a faculty-led travel course and a place-based experience which gives students the opportunity to see firsthand some of the issues that you learn about in the classroom in the community. It also gives students an opportunity to use some of the skills and knowledge that they've gained in the classroom through service learning. So we piloted this course for the first time last year here in the Deep South, and this year we went to Panama with a great group of students. And I'm not saying that just because some of them are sitting in front of me. They really were good students. We saw some wonderful things while we were in Panama, but we also saw some things that were very difficult. We saw how poverty, stigma, and social isolation are affecting the most vulnerable people in Panama. So students are here today to share their experience with you and to give you some of their perceptions of health in Panama. And because they couldn't cover everything in the presentation, they developed a vision board that's up here on the right and created a word cloud, which is the butterfly symbolizes biodiversity, and you'll see why that's important in a while. But also they created a word cloud that kind of captures all the themes of all the things that we saw. So y'all take a look at that on your way out today. And there's also some items that we brought back with us from Panama that you can look at also. When you came in today, you received a card with 2 QR codes on it. One of those QR code links to the blog that they did. So more details on what we did daily, you can find that in the blog. The second links to a podcast that we'll tell you more about in just a second. Let's see. And then at the end, I'm really excited to be able to tell you all more about what we're planning to do in 2020 with Exploring the Population Health course. So as students come up, they're going to introduce themselves. Our kickoff speaker, she hasn't quite made it here yet, so I'm going to kick that off for Jada. So she'll be here hopefully before this is over. Okay, so who went with us? We had 15 students that were representing undergrad, graduate, doctoral, and certificate programs here at the university. We had majors from public health, biology, and medicine. And from the public health majors, we had representatives from health behavior, EPI, environmental health, MCH, and global health. So we had a good group of people from different backgrounds that went with us. This course took place in the May mini-term this year. We actually traveled to Panama from May 15th to 26th. We spent 7 days in Panama City and 4 days in Chitre, which you'll learn about a little bit more in just a minute. Before we left, we visited several locations, including the 1917 clinic, to learn about HIV in Alabama and testing, treatment, and care services here in Alabama. We went with representatives from the Jefferson County Department of Health, Department of Environmental Health Services to learn how environmental health services are executed here in Alabama. And then we met with UAB Archives and Tim Pennycuffs, who's back in the back, hey Tim, to learn about the historical connections between Alabama and Panama. And we learned so much from Tim. We were just so impressed with everything he was able to pull out of our archives about that connection. We recently recorded a podcast with him, and that's what that second QR code is on your card that you were given, and it's also linked from the Get a Handle newsletter. So we won't have time to cover all of that today, but I wanted to link y'all to that because there are some pretty incredible linkages from Alabama and Panama, historical linkages, including Dr. Gorgas, Lloyd Nolan, and others that were working here in Jefferson County to eradicate vector-borne diseases that actually learned their skill working in the Canal zone in Panama. So take a listen at that. Now, before we left, the students had a lot of work to do. They had a lot of readings, but they had to really, they worked in groups to come up with definitions based off the readings that we had read for population health, health equity, social determinants of health, and culture. And they used those definitions as a guide for themselves as we visited the different sites in Panama. And so they actually had these definitions posted in the front of their journal. And as they were journaling every day, they would refer back to those definitions to kind of keep some continuity of what we were doing. They also had to do presentations on the history of Panama, on Panamanian culture, on the health system and public health system in Panama and how that's structured, and on health status of Panamanians. So they did all of this before we left, and now I'm going to pass it over to Jennifer, who's going to take it from here.
Hi everybody, my name is Jennifer Schusterman and I am a MPH-MCH student, and this is my last semester, and I was lucky enough to be able to go on the study abroad last year and as well as this year. I'm here to tell you a little bit about the geography and the history of Panama. So to begin, Panama, it is a land bridge. It actually connects North America to South America. And it is bordered by Costa Rica, right here, and then Colombia, the Caribbean Sea, and the Pacific Ocean. The country has rich biodiversity with biomes that include rainforests, mangrove wetlands, and mountain cloud forests. The land is home to some of the most diverse and exotic species of planets of animals on the earth. The human population is in the upper middle class. However, there are some gaps in wealth, just like you would see here. The country's population is 4.10 million, and if you were to look at that, comparing it to Alabama, Alabama's population is 4.87 million, so similar populations. Panama City, which is the largest population in the country, has 880,000 roughly. And if you compare that to Alabama, Alabama's population in Birmingham is over 1 million.
In the metro area.
In the metro area, yes. So there were 3 locations that we visited while we were in Panama. The first was Panama City, which is marked here with number 1. And Panama City is the most urban area of the country, and it's located on the Pacific entrance of the Panama Canal. Chitre, which is marked here as number 2, is located in the province of Herata, and it's more rural, and its city population is 9,000, so much smaller than Panama City. And the last location we visited is marked here number 3, and you can see us here. We had to actually take canoes on the Chagres River, which is the largest river in Panama, to be able to visit with one of the indigenous tribes there, which is the Mbura tribe. And they primarily, make a lot of their money off of being able to have tourists come in and visit. So now a little bit about the pre-colonial and colonial Panama. So this is Panama Viejo. It is a World UNESCO site, and it was founded in the 1500s by Spanish conquistadors. 200 years later, it was sacked by Captain Henry Morgan, and in response to the pirates sacking the city's governor had the city burned. So the city later was relocated to Casco Viejo, which is known as Old Town. That's what it translates to in Spanish. And this is a historic district of Panama City. The city was built on a peninsula. It's isolated by the sea and a defensive system of walls. It was founded in 1673, and its buildings are primarily Spanish colonial, and it is also, just like Panama Viejo, a World UNESCO Heritage Site. So, Panama Canal. Why did they choose Panama to build this canal? So that they could shorten the trip of having to go around South America to be able to ship goods and people. So geography answers this question. Panama is on the Ring of Fire, just like most of the countries in Central America, actually all the countries in Central America. However, it is not prone to having as much tectonic movement, so doesn't have as many earthquakes as countries like Nicaragua, which was the first choice for the Panama, or for the canal. So you can see here we have this arch. This was kind of a testament to the fact that Panama was not subjected to as many earthquakes. It was built in 1678 specifically. It is 35 feet high, it is 49 feet wide, and it has not sustained any damage. So this was a testament to the fact that the canal should go in Panama because it's not subjected to earthquakes. Here we have an image of one of the ships going through one of the locks of the canal on the Pacific side, and some of us having fun with the pictures that you can take there for a small fee. So, building the canal. The project began in the 19th century by the French, who had recently just completed the Suez Canal in Egypt. Unfortunately, the French were not as successful in Panama because there's different terrain. It's not sand like it was in Suez, and they didn't have the equipment or the technology or the engineering skills to be able to build the canal. Not only that, they were also having issues with the fact that there were numerous vector-borne illnesses, so malaria, yellow fever. 20,000 people, 20,000 workers during the French time period of trying to build the canal died because of these illnesses. And you can still see these French cemeteries while you're in Panama City. Obviously, this picture right here, we didn't take it while we were there. It's an older picture. So the Americans took over building the canal after the French decided that they basically went bankrupt and they couldn't continue building. So the Americans took over, and they needed to be able to deal with these vector-borne illnesses. So they brought in an expert at the time who was Dr. Gorgas, and he came in and he did a lot of things to try to alleviate some of these problems, like stormwater runoff and dealing with sanitation systems. And by having all these different things to try to prevent vector-borne illnesses, it led to defining the culture's thoughts on vaccinations. It is much cheaper, less expensive to vaccinate than to deal with an epidemic, and they knew this firsthand. And if you think about Panama, Panama has ships coming in from all over the world where people are coming from different countries, and they could bring illnesses with them. So having vaccination is a big part of their culture. So a little bit about the history of the Panama Canal Zone. So when the Americans were in the canal area, the canal zone was American, and Fort Clayton was the military base that was located next to the canal zone from 1919 until 1999. And Fort Clayton is actually named for an Alabama native who went to the University of Alabama, but we won't hold that against him. And it closed after the Torrijos-Carter treaties, which started in 1979, and it was a staged progress of being able to move out of Panama and relinquishing power to the Panamanians. This is an image of the Gorgas Hospital. The Gorgas Hospital is located on, I think it's Ancon Hill. And this hill was significant because it was actually built during the French time period of being in the canal zone, and they built this wooden structure which was later replaced with cement because humidity and wood don't go really well together. So they rebuilt this, and it was built on this hill because it was away from the sewage, it was in clean, healthy breezes, so that they would be able to work with patients that had yellow fever or malaria, and it still stands today. And Dr. McCormick risked her life so she could take this picture for you all. Currently, the City of Knowledge is actually in the location of where Fort Clayton was, and it is a nonprofit. and it's a nonprofit park. And the businesses and organizations that are there are numerous. We have government-sponsored or academic organizations such as the Balboa Academy, USF, and FSU. There's technology companies. There's non-governmental organizations like the Red Cross and the UN. And the mission of the city is to be innovative and to encourage social change through humanism, science, and entrepreneurship. And we were lucky enough to be able to visit this area and see all the work that they're doing. And currently they are heading the initiative to be able to help with recovery from Hurricane Dorian. And with that, I'm going to pass over the lectern to Tim.
Hey there. So my name is Tim McWilliams, and I am a dual degree student, dual MD and PH. So I'm just now starting our second block in med school, and as you would imagine, having a lovely time. But moving on. So one of the first things that we really noticed when we got to Panama was just some of the levels of income disparities. So those photos you see on the right are both in Panama City, and you can see this is more like the coastal affluent area, and it's just skyscrapers everywhere, high quality restaurants, very state of the art. And then the photo directly beneath that is probably 20-25 minutes away off the interstate in a more local residential area. Super dilapidated, kids just walking around in the street, and a lot more issues. Those photos in the middle are both taken in the Las Mananitas district, which is right by the airport in Panama. That is taken from the back of the bus, and as you can get an idea of some of the housing in the area, a lot of them just have like tin roofs. The bottom photo shows that most of them just have really remote like windows that are open to air so vectors can get in. A lot of them didn't even have doors. That's just one of the photos that we got. And then in Chitre, as you can see in that bottom left photo, this was actually a landfill that was a little bit away from one of the elementary schools. And basically they just take all of the trash in this area and dump it in a residential area. And as you can see, there's a lot of livestock. So the whole time we were driving through, there were cows and chickens and everything around just sitting in the trash essentially. But that was something that was just present throughout our whole time in Panama. Moving on, something that we really learned quickly from a lot of the talks that we had was they had a really unique culture on just building their knowledge on health. So one of the initiatives that stood out was from this photo that you can see in the top left of their smoking cessation campaigns. They really built just a culture against smoking. In all of Panamanian public areas, it's illegal to smoke. And you can see a lot of these signs would be up in the city or on the back of like cigarette cartridges. Furthermore, they had a really interesting health culture on vaccinations. They have an incredibly high vaccination rate. And in Panama, if you bring your child into a hospital with a vaccine preventable disease, they can actually pursue criminal charges against the parents. So it's just in their culture. We asked the nurses there, do you ever get issues with people not wanting to vaccinate? Just nope, never. We just don't see that. It's just what they do. But on the flip side of that, there were a lot of negative health behaviors that we really saw throughout the country. So one of the infectious diseases that stood out in Panama was their issue with HIV and AIDS. In Panama's culture, they're a really Catholic nation. So they had a big issue with people in the MSM community not coming out to get tested. And really, when they would present at hospitals for treatment, it would be in late-stage AIDS. Which is really interesting because the government in Panama started an initiative that they get free preventative care for AIDS. So any sort of condom access and that sort of thing, they get free from a lot of the government clinics, but people aren't coming and aren't accessing that treatment because of the stigma associated with it. Furthermore, they really had issues with alcoholism in the country. According to the WHO, it's the second highest rate of alcohol consumption, and they had 20% of the population that was quoted as drinking excessively. Furthermore, something that just we wanted to build on is they just really had a really strong sense of culture throughout. A lot of what we did was learning in this trip, but we also did get to have some fun and see some of the cultural aspects of Panama. So some of these photos you can see in the bottom left there and in the center. We got to go to a cultural dinner one night where they just gave us a lot of local Panamanian food. They showed us this traditional dance that they use with those female dance garments. When we went out to the Embera tribe, as you can see, they also were really present on that like food culture. They came and cooked a traditional meal for them, which was fish and fried yuca and a lot of fruit. And they're really proud to like sell a lot of their sort of handmade ornaments. So you can see like a little wooden carved one. People really like their little hat things. You can see in that top left one, all the little kids have their little hats at school for that photo. And then they really like to show a lot of their culture and a lot of just their diversity. In that bottom right photo, the really colorful building, that is the Panamanian Biodiversity Museum. And that's a really cool thing that you can see it through a lot of the city because it sort of sits on the coast. And it really stands out. And it's basically just this huge museum where you walk in and it's super interactive. They have panels that you walk through, and it just walks through like the history of Panama, kind of how they got so much biodiversity with like the land bridge formation. And it talks a lot about like the Panamanian culture and what they've done to conserve their environment. So it's just a huge museum that you could walk through for hours, and it was really interesting. Moving on. So one of the other really cool cultural things that we got to do was we got to spend a day going out and visiting the Mbeda tribe. So they are located kind of about an hour and a half out from Panama City, and then from there you have to take a canoe out to where they live. So we all boarded into these little shaky canoes and rowed out for 15 minutes, which was interesting because you saw little like baby alligators like in the water, and that was not fun. But that's the sort of thing they have to live with. And as we were kind of like floating by, you see little kids just walking in the water, and there are alligators just a little bit like 2 minutes before. Like, I would not get out of that water. But they're about 20 minutes to any sort of hospital. It's a really remote location. So they really had to develop a lot of their own system of what they used for healthcare in their environment. And they use just like a shaman, a herbalist, or a midwife for a lot of their things. And they had a lot of really interesting cultural practices. As you can see through some of like their photos, they don't wear shoes anywhere throughout the tribe, which would present some health issues. The meal that they cooked for us, it's kind of hard to see in that middle photo, but it was all done on open air cooking, no sort of ventilation at all. They had little kids sitting right by the flames. All of the houses were raised on stilts, as you can kind of see in that right photo, to prevent any sort of like predators getting in. But most of the entrances and windows were just wide open. Like maybe they had a sheet blocking part of it, but just completely open to the air, so any sort of vector, any sort of just inclement weather could just get into the house. They talked a lot about some of the health issues that they thought the indigenous people faced in Panama, and some things that they really stressed to us were just access to care. Child marriage is a huge issue in the country, domestic abuse, and those sort of issues. But they did show us a lot of like their culture that they're proud of. They showed us a lot of like their sort of garments. You can see on the male like tribe leader there, he had like a bead necklace thing. They had really unique dress, and they showed us like a huge dance that they got us to join in on. And they also had like a little baby monkey that they found out in the woods and had been nurturing back to health, and he was really the star of the show. But that's all for me. I'll pass it on. Thank you.
Hello everyone, my name is Lakeitha C. Royer. I graduated last month with the Masters of Public Health and Health Behavior, and I'm going to be talking to you all about the health systems in Panama. So healthcare in Panama is provided through a system through the government and a private sector. The public sector is funded through the Ministry of Health and the Social Security Fund, which operate separate facilities. The Ministry of Health assures public health access to all the country's population, and right now about 40% of the population utilizes health services within the Ministry of Health. Those health services provided by the Ministry of Health consist of 3 levels, level 1 being prevention-based and includes vaccinations or immunizations, which Panama has a very high rate of. And level 2 is intervention-based, and 3, specialization, which includes services such as cancer treatment. So the Ministry of Health includes public hospitals and salud or health clinics. The salud clinics were easily recognizable throughout the country because they all are painted white with a green and yellow logo on them as pictured on the slide. You can expect to pay as little to 50 cents to no cost to see a doctor within the Ministry of Health clinics. Therefore, a lot of the poor and indigenous population rely on these clinics. The most working people in their immediate family have access to the Social Security Fund or CSS. Everyone who works in Panama is required by law to pay into the Panamanian Social Security system, and it covers sickness and maternity benefits. By paying into the Social Security system, an employee is gaining immediate access to health care each month he or she works. And the quality of care for this system varies. Sometimes there can be really long waiting periods compared to the Ministry of Health Services. Currently, about 60 to 80% of Panama's population utilizes this system, and this percentage overlaps with the Ministry of Health. Lastly, the private healthcare facilities in Panama are mostly utilized by the middle and upper class Panamanians. It is also a popular system for medical tourism, as they are witnessing an increase in the number of people who are traveling to Panama for cheaper healthcare services. This is the most expensive system in Panama, but it's cheap in relation to what we see here in the United States. Panamanians who utilize this system are ones who can afford this quality of care. It has the top-of-the-line treatment, and services are offered in the private healthcare facilities. Only 10% of Panama's population utilizes this system. So while we were in Panama, we were able to visit 2 Level 1 Ministry of Health centers, which offer both preventative health services and some primary care for all age groups. On the left, we have pictures from the Las Mañanitas Health Center, which is located right outside of Panama. When it opened in 1989, there was a population of 25,000 people in this district. But now the health center serves about 60,000 people, and it only has about 58 employees, which includes the administration there. The standard of care there was not what we are accustomed to seeing here in the United States. The waiting room was really crammed with people, and it was obvious that they were understaffed as well. Within this community, most of the people do not work enough hours to be able to contribute to the Social Security program or pay for the private insurance. So this public health clinic is the primary outlet for this population to access health services. The lines there to see a doctor usually start around 5 o'clock a.m. when the clinic opens. And on the right, we have the Chitri Health Center, which we visited. It's also a Level 1 facility, a part of the Ministry of Health. It serves about 118,000 people. We met with 2 nurses that work there, and they expressed that they do not have enough space for the quantity of people that they serve. And because they are big on prevention, they take immunizations extremely serious and follow a strict vaccination schedule. We were impressed to learn that they immunize 95% of people, which they believe is their greatest method to preventing mortality and morbidity. They even travel to people just to ensure that everyone is getting the vaccinations that they need. And then we visited 2 Ministry of Health hospitals. The first one was Santo Tomas, which is located in Panama City. It is the largest public health hospital in Panama. And to give you an idea of the hospital size, it has 632 beds compared to UAB's 1,157 bed facility. Santo Tomas is a Level 3 hospital and provides the highest level of care through the Ministry of Health. Currently, the hospital includes a maternity ward, emergency department, outpatient clinics, internal medicine, general surgery, and an infectious disease ward, and also medical specialties. Santo Tomas is the location for specialties for these people without private or Social Security insurance. While at Santo Tomas Hospital, we received a tour of the infectious disease ward and also the HIV/AIDS clinic from Dr. Arus. You hear more about what we learned from her later, but it was interesting to learn about the infectious disease health services offered there. There are actually 40 beds for patients with infectious diseases, but at the time we were there, they had 60 patients who were admitted with infectious diseases. This puts into perspective that also Santo Tomas is the largest public hospital in Panama, is still not equipped to meet the need of the population. The Herrera Regional Hospital, pictured on the right side here, is a Level 2 hospital with 135 beds. And as a Level 2 hospital, it does not have the resources to provide specialty care for patients. So patients needing those services are referred to a larger Level 3 hospitals, such as Santo Tomas in Panama City. We noticed that there were several private clinics surrounding the hospital, but those clinics only accept patients who can afford the private insurance. This creates inequity in the community around access to health services. And like the health center that we visited in Chitre, the hospital has a huge focus on maternal health and averages about 85 births per month. The services at this hospital are one step above what we observed at the clinics that provide preventative service and outpatient services. They lack many resources there. However, it is evident that they are attempting to maximize those resources that they have to provide a wide array of services. And pass it off to Sloan.
So hi, my name is Sloan Oliver. I'm a senior here in the School of Public Health, and I will be talking about the environment and their sanitation practices. So while we were at the Las Medinitas clinic right outside of Panama City, we were able to meet with the environmentalists that work there. They have a team of 4 serving a community of 60,000, which is 1 worker for every 15,000 people. Compared to Jefferson County, we have 1 environmentalist for every 6,000 people. So their job is very difficult, and they are doing a lot. And so they're focused on immunization and eradicating yellow fever and dengue within their populations. As you've heard before, they have a really big focus on vector-borne diseases. We were 3 times a year, they go to the residencies of everyone in the community and look for standing water, because that is the breeding ground for vectors, and either correct or dump the water and tell them how to fix it and prevent it, or tell them how to fix it and prevent it and come back and see if it's been done. And then they continue to go back until it has been done, which could result in a fine, but most people fix it before then. And we were able to go on 2 of these visits to different people's houses within the community and search for standing water. We were actually able to find little larvae in some of the standing water, but it was flies and not mosquitoes, but they still had to dump the water, and the environmentalist explained why the water was there and how it could harm them if mosquitoes were to breed and carry a disease. These workers not only go to the different communities, they also have educational campaigns and then offer routine immunizations within the clinics for these vector-borne diseases. So just comparing Panama to Alabama, we all know that there are issues in Alabama with our food, air, and water. So I'm not going to get into it too much, but we do have landfills contaminating communities, and then sewage leaking into our water systems, and manufacturers releasing a lot of chemicals into our air. But for Panama, we did visit in Chitre. We went to an elementary school, and pretty much adjacent to the school, right in that community, was this massive landfill that Tim was talking about, where they just dump trash and leave it. The animals eat it. And it's also right next to a river. And so that contaminates the river, which people use for subsistence fishing. And what you can see on the left, we actually saw them fishing in that river right after we had been to the landfill, which is contaminating the river. So the environmental unit is working to prevent these, but they are understaffed, and they're doing everything they can. But it's hard for them to recruit more people to work in that unit, which is a risk of losing a lot of institutional knowledge regarding the environmental practices that they do.
Hi everyone, my name is Leah Grace Simons. I'm a student in the Department of Epidemiology and the Global Health Certificate Program. So as we stated earlier, there's a lot of stigma related to HIV and AIDS in Panama, and a lot of this comes from the knowledge of the people knowing that they have HIV but not wanting to get diagnosed, because then they'll have to do something about it. So in some of the regions in Panama, these include Panama City, the city of Colon, and the region of Chiriquí. They have higher rates of HIV there. So in Panama City, this happens because of more treatment areas or areas of treatment in the country. In the region of Chiriquí, there's a higher rate because of migrant workers coming from their indigenous areas to then work in Panama City, they may then get infected and spread HIV throughout their community at home. For the city of Colon, there are influence of the Caribbean through that city. So a lot of the gender norms are more fluid and not as strict. So a lot of the infected are men who have sex with men. But in general, Panama is working to towards the goal, the 90-90-90 target goal. But these are all estimates of the HIV rates in the country. So approximately 70% of those with HIV have been diagnosed, and of the 70%, 60% have received care. Of the 60% who have received care, 60% have been virally suppressed. As we see in Alabama, around 84% have been diagnosed, and then a difference that we see are numbers of those who have received care and those who have been retained in care. So 57% of the 84% who have been diagnosed with HIV have been retained in care, and of the 73% who have received care, 62% have been virally suppressed. Another difference are the PrEP services available. So in Alabama and the United States, PrEP is widely available, but in Panama you have to go to a private clinic, which is extremely expensive. There's also limited access to newer medicines, and medicines are only prescribed within a 30-day period. And another problem with diagnosis in Panama is that only a certified lab tech can diagnose or run the rapid HIV testing, and it has to be in a clinic, whereas in Birmingham we have the mobile testing clinics. If you want to learn more about HIV in Panama, with testing, treatment, and care, there's another seminar with Dr. Arose that we met that would be able to tell you more about that. So for STI screening, a lot of the things we learned in Panama is that their culture of prevention, but in Panama they only screen for syphilis and no other STIs. So with the country being so heavily Catholic, sexual education and ideas of sexuality are very conservative, though the ages of 15 to 18 have higher rates of chlamydia. But they're not more often tested, or they are tested at private clinics, but they're not routinely tested. However, vaccines are present throughout the school, so they're able to receive a lot of their vaccinations, which contributes to the high vaccination rates, except for the HPV vaccine. That vaccine will need to have parental approval of the vaccine, and it was marketed as a vaccine towards cancer, but the rates have been reduced more because of the sexuality component now addressed towards it.
Hi, I'm Amy Badham. I'm Director for the Office of Service Learning and Undergraduate Research, and also a PhD student in the Health Education and Promotion program. And it was like really a huge privilege for me to get to go on this education abroad trip with Dr. McCormick and Dr. Austin and Mina Nabavi. What I'm going to talk about, and part of the reason I was so interested in going, is that it was an education abroad class that was also service learning, and there's a lot of question about how to integrate those effectively. So before I talk about the educational system, I'm going to talk a little bit about service learning in general. So in order for a course to be considered service learning, for it to be designated as such, you have to find a community partner who has an idea for a project to work with you, right? We don't just come in and say, yep, we're here, we're going to fix it, right? So you really want them to invite you in and ask you for what they want. And the public schools in Chitre did that. We also worked with the Senior Center, and you're going to hear about that in a minute. We have to use our course content to address the issue. So again, it's very focused what students should be doing with these projects. So we were focused on population health and health disparities, and then health, and in this case, educational equity. So we focused on those. In service learning, everything needs to be mutually beneficial. So there needs to be a benefit both to the community but also to our students. And you know, really us going in and being in Panama for 11 days, you always question, like, how much benefit can there be? But there truly was, and I'll talk a little bit about that. And then finally, with service learning, you have to reflect on what you've learned and how it has impacted kind of your preconceived notions about the population you were working with, preconceived notions about issues you saw, how you might have grown yourself, what are you going to do next? So those were really the things that we worked on. So we were invited into 2 elementary schools in Panama, in the city of Chitre. And so when we were going in, we thought about the difference between education in Alabama and Panama. Well, you know, in the United States, we have public education available to all. Some people choose private school, but the government pays for education. It's mostly free. Those of you who have children know it's not entirely free, but it's mostly free. And there are attendance laws, right? You have to go to school. In Panama, because they have such a high population of young people, in order for them to meet the needs of universally educating all their students, children only go for half the day. There's the morning group and the afternoon group, and they swap because there's just not enough infrastructure to accommodate all of them for the full day. It really is, you know, a privilege to be there. We heard about, on one of the bus trips from somebody, I'm trying to remember who told us this, but they were describing to us that there was the government offered stipends so that people would send their children to school because they were really going for universal education. But oftentimes, people would enroll their children, get the stipend, but then keep their children home. And so they were having to battle some of that. And so people that could afford it, who didn't want their children to just go a half day, wanted them to be in full, would choose the public option. Sorry, the private option. So what did we do? So service learning in public schools in Chitre. So we were really excited because before we left, the Alabama Department of Public Health offered to give us all these little teeth cleaning, dental hygiene kits. So, you know, when you go in and work with school children, how many of you have ever done that, right? Where you go in, it's nice if you have prizes, right? So we wanted to come in and have giveaways. So that's what we did. So we had toothpaste and toothbrush and floss. And the little ones that we worked with, they learned about hygiene, both dental hygiene and hand washing. And it was really great because the UAB students went in, they were working with little ones, so they did it with songs and games and just basic interaction. And of course, it's really surprising. I think we all found they know more than you think, right? We're not going in, it's not like they don't know this. But it was great reinforcement. And then at the end, we always left time for questions about what is America like in general, because, you know, we were somewhat serving as ambassadors there. So we visited 2 different schools. The first one was the Hipólito Perez Teo School, and the second was the Anita M. Castillero. We were only supposed to go to one, and this is where flexibility is so great when you're working abroad, is we were invited by a group of nurses to go to a school where the children would be considered at risk. So it was the poorer school. You've heard about the landfill and you saw the cows. It's the school that serves those children. So for the UAB students, it was so amazing because they got to see that comparison. They got to see that educational inequity that we all know is what we exist with here in Birmingham, right? With, you know, schools this way versus schools this way, and we saw it there as well. So the students designed these lessons. We did a lot of the design before we left the States and then implemented while we were there. We had to be quick on our feet because we never knew how long we were going to have, how many children we were going to have, but it went really well and we got really positive results. So we did hygiene and hand washing with the little ones. And then for the 4th graders, they had asked us to do vector control. So we created games around vector control, you know, like where do mosquitoes breed? You know, they need the water. And again, they all knew so much because this is what they live with. You saw those environmental agents that are going out and checking their homes. You know, they're all aware that, you know, that you ask them, how many of you have known somebody with dengue? You know, every hand goes up. How many of you have known somebody, you know, with chikungunya? You know, hands go up. So just they had so much awareness, but it was fun with that group. We had little blazes to give out. We had T-shirts to give out. They got pencils and some books to work in. But it was really positive. And the UAB students, it was so, you know, amazing for them to have this opportunity to learn this information about vector control. We don't think about it as much here as they do there because, you know, we have often. We don't have malaria here. But, you know, where the stakes are high, going into the school and interacting was just amazing. So that was service learning on this trip.
Hi, my name is Sally Engler, and I'm participating in the Global Health Certificate Program. And I was thrilled to see that there was a study abroad program with UAB that could count as part of that program. One of the places that we visited was called Nutria Hogar, and it's a recovery center for children suffering from malnutrition. Basically, we met with a pediatrician and the agency's administrator. They explained that once Indigenous children are hospitalized or they're assessed to be malnourished or underdeveloped, a doctor will make a referral for the family. So Indigenous parents, of course, they have to consent, they have to be agreeable for their children to be brought into the clinic or the home outside of Panama City. And sometimes they can stay there from 6 to 9 months for rehabilitation. It's on the keyboard, yes, okay. Okay, so as Amy mentioned, we did an adult health education activity as service learning, and we went to a senior center. We had planned to offer motivation and demonstrate some exercises to a group of patients that we thought would be in a waiting room, and it ended up being kind of a community center, a senior center. And so we first presented on physical activity. We explained, you know, about the benefits of physical activity, how much physical activity, you know, we need to be doing every week. And then we also demonstrated some sitting exercise just from the stage. And then finally, we asked them what type of exercise they like to do. And these women were probably between 70 and 85 years old. And so, well, they said that they loved walking, and it was clear that the favorite thing to do with physical activity was dancing. And so Mina had, of course, brought a cube speaker with her. And so, you know, before we know it, we're in the back of the room, and UAB students are leading the Macarena. What's going on? Oh, sorry, it flipped back.
Just bumped across.
Did it go back? Okay. So as soon as, you know, they danced to our tune, one of the kind of the leaders of their group said, well, we want to teach you our dances. And so they found music and projected it through the speakers, and before you know it, we're being taught how to do Panamanian dances and to Panamanian music. And so in that sense, we had a truly two-way service learning experience. So do we have enough time? Okay, so basically you can see that the activities that we did touched on all of the themes of the course. We learned about challenges with access to care, even when there's a system where everyone supposedly has universal care, but that system is not resourced or staffed or funded to be able to provide care to all of the people who would have access to that care. We also gained extensive knowledge about public health and in Panama, and we had direct field experiences that will stay with us for many years to come, and hopefully in our future jobs. And so in particular, we really learned about the place of the Panama Canal in Panama, in the region, in the world, and the public health issues that had to be solved for it to be built. And we also were able to realize that yes, there were a lot of differences between our experience here and what we saw in Panama, but we saw a lot of similarities as well, as you saw throughout the slides. So, and then, of course, there's a mountain of people to thank. And come on. Okay.
Okay. If you're interested in an experience such as this, our blog post, you have the QR code for that. But in 2020, we're planning for Exploring Population Health United Kingdom. So if you're interested in this kind of experience, I would love to talk to you. Our travel dates are going to be May 17th through 28th of 2020. Of course, there'll be some meetings before we leave, so there's in-class work before we leave, and there will be some post-trip classes. We're going to have experiences in both London and Stoke-on-Trent, which is located between Birmingham and Leeds. It's a 6-credit-hour course, open to undergraduates and graduate students, and can count toward your capstone or any of elective credits. You'll have to see your advisors or program coordinators to see how that can work for you. There are scholarships available through Education Abroad and the UAB Alumni Society. In fact, 2 of our folks that went to Panama with us got $750 scholarships from Education Abroad and Alumni Society. And UAB School of Public Health is going to provide $1,000 travel stipends to the first 10 students that sign up and pay to go. So that is a plus. And the exact pricing on the trip is still to be determined, but it's going to be around $3,000, the program cost, plus tuition and flight cost, which is around $1,000, just to give you an idea. But we're going to be posting a link to the exact cost and the Education Abroad site when we get that in the Get a Handle newsletter. So what are we going to be doing? We're going to be going to Stoke-on-Trent and meeting with some folks at Staffordshire University. We're going to learn about Public Health England and the National Health Service in the UK. How is public health and healthcare structured there versus how is it structured here in the US? We're going to learn about priority health concerns in the United Kingdom and a lot about the pottery industry, because Stoke-on-Trent is kind of central to that in this country. A lot of occupational exposures. We're going to go to IM England. This is known as the Plague Village. This is a village that isolated themselves, quarantined themselves to stomp out the plague epidemic, and 240 something of their residents died in 1666 due to plague because they isolated themselves. We're going to go to the British Museum. I don't know if y'all know this, but the English pilfered the world and took it all back to the British Museum. This is where the Rosetta Stone is, the Lewis Chessman. I mean, things that you've heard about your whole life, but we're going to do a public health scavenger hunt in the British Museum. And we're going to go find things that have significance to health, healthcare, and public health. You can't touch them, but you can take a picture of them and write about them. And then we're going to talk about that. We're going to go to the London Eye and do a tour down the River Thames, and we're going to talk about how they've been able to bring the river back from the dead. Basically, 60 years ago, nothing lived in the river, and today it's thriving. We're going to talk about the history of public health, and we're going to do several walking tours. We're going to go see where John Snow removed that handle off of the water pump to stop the cholera outbreak. We're going to go by the Millennium Hotel, where Alexander Levetnenko was poisoned with polonium-210 in his teeth. We're going to walk across the Waterloo Bridge, where Georgy Markov was assassinated using ricin. We're going to talk about the Great Smog of London that happened in December of 1952 and kind of the environmental issues around the industrialization of the city. We're going to talk about built environment and health. We're going to talk about London's climate change adaptation strategy. And depending on how many students we get signed up and the timing, hopefully we're going to be meeting with colleagues at the University of College London to talk about their active buildings project, where they are building buildings that promote physical activity. So office buildings, how do we make them where people can be more physically active? Because we're spending 90% of our time indoors. And then hopefully with the London School of Tropical Medicine and Hygiene, which is located right behind the British Museum, they do some walking tours, and we hope to be able to link up with them. And then with some community partners and service learning opportunities. So those are the kind of things that we're going to be doing when we're in the UK. If you're interested in that, I'll be glad to meet with you. Mina will be glad to meet with you. Here are our email addresses. And watch out for the Get a Handle. That's where we're going to be putting links to UAB Education Abroad and the application for the course. That's it. Thank y'all.